So why is this medical grade honey useful? There's been some research into why. First of all, as Dr. Arbuckle was mentioning, it sort of draws the fluid out of your wounds. It can bring, basically, through osmosis, bring up the moistness from your wound bed right into that dressing and then leave it as a covered layer on top. There's what's called a hydrogen peroxide effect formed in a slow release manner by the glucose oxidase enzyme present in honey. And it's highly acidic, which is not good for bacteria either. So I'm not going to go through the world's literature on honey. I'll mention a few. This study looked at the antibacterial activity of honey and the reduction of skin colonization with use of a medical grade honey. And here are the bacteria that it showed that it killed in the lab. Staph aureus, Pseudomonas is on the list, quite a few bacteria that it was useful against. Then in practice, they applied it to the skin of people with intact skin and looked at their bacterial cultures before and after and did find a reduction in the number of bacteria living on the skin and a decrease in the number of skin cultures. Now, when you get to MRSA or resistant Staph aureus, there's some evidence that honey is effective against MRSA bacteria, which is good. And though when you get to the actual use in human wounds, it gets a little bit more difficult to prove. There's a Cochrane database that looked at a number of trials, and this just, as Dr. Arbuckle can relate to, is that it's very difficult to do a scientific, randomized, blinded, controlled trial comparing wound to sort of prove your effect. So the Cochrane database looked at all the open label and other kind of trials that have anecdotally looked at this, and their conclusion was that honey may improve healing times in mild to moderate superficial and partial thickness burns compared with conventional dressings. And there, again, as Dr. Arbuckle mentioned, MediHoney is the medical grade honey available in the U.S. that has a regulatory approval for wound care as a wound care product. So honey in practice, it's, first of all, sticky. We heard a bit about, and because it's a desiccant, or sort of drawing the liquid into it out of your wounds, one of the practical tips we hear from our patients is to soak those dressings before you remove them to minimize the pain associated with them. So the good things about it, again, that medical grade honey shows effectiveness against resistant bacteria, which is an important thing to know for the horizon. But of course, we need more studies to prove its effect, and it can be costly. I mean, certainly compared to the over-the-counter bleach and vinegar, it's more expensive. But again, you need to your wound care supplier to work with the cost for that one. So, just some of the take-home points. Review your wound care with your regular doctor, and of course, there's always our nurse educator, Jerry. She's going to love me for plugging her to call her for advice as well for some of these recommendations that we give you. See your doctor if its wounds are not healing well or have signs of infection, of course. And any questions, let me know. Thank you. Yes.
I used to use vinegar baths on my daughter all the time, but she gets something like cellulitis in the spring. And so I put her in the vinegar, and it made it worse, and I quit using it just because I was having problems with that. Do you know anything about resistances to vinegar or anything like that?
Right. I think it's possible. There's not a lot written about it, but it could depend on the concentration that you're using. And certainly if that's what's happening in practice, that's quite possible. I mean, generally it's not something we're using as a treatment. It's more using it in the low strength for prevention or control. And it's certainly theoretically possible, although not a lot is written about it. Yes? And I generally recommend plain white vinegar. One of our tenets in pediatric dermatology is the more simple, the better. The more things you're putting on your skin, the more potential for contact dermatitis and allergic reactions that you could be developing. And I haven't seen much on research about the pectin to justify using something besides white vinegar. Yes?
On the solution you're making of the bleach, where the 1 to 2 teaspoons to 1 gallon of water, how long is that good for? Because like Dakin's is only good for, I don't know how many days, but
right.
You have to throw it away.
You should make it up fresh. Make what you need and then get rid of it.
Each time?
Yes.
Okay. Thank you.
Yes. Yes.
On honey, what if you have a bee allergy? Can you still use it?
Good question, and I don't know the answer to that. It could potentially contain some bee antigens, so personally I wouldn't test it out. I don't know if the company has done any studies on that. I'd have to ask. Yes.
This is just more common. When my son was little, and actually throughout the years, we were using vinegar, 1 part vinegar to 3 parts water for Pseudomonas in his foot. And it was a good soak. We did it 3-4 times a day, and it'd knock it out within a couple days. So.
Great. Yeah. I mean, like I said, the concentration has been all over the place in terms of what's looked at in the lab, and we're sort of doing the best we can with how we're translating that to what we're using on our skin. It worked great.
Yeah, but it's interesting because the vinegar actually pulled the infection. I mean, it pulls it out somehow.
Good. All right, thank you. Who's Jerry? Oh, sorry. Another.
Dr. Morel, excellent talk. Very useful for us.
Thank you.
I want to ask you about silver products. Do you have some data about how it be at toxic level, or you can use it for a long period of time? What's your recommendation?
Right. Good. We generally, when we talk about silver products, we know that there can certainly be absorption of that silver. So my recommendation is if you need it and you don't have an alternative, use it for a brief period of time on an isolated wound. My recommendation is not to use a silver product on your entire body for a long period because of the silver absorption. You can develop argyria, and it's controversial as to whether there can be effects on the kidneys with like a metal toxicity effect. So short course to try and help heal a difficult wound, sure. All over your body every day, not recommended. Okay, thank you.